would you like to be able to reduce chronic pain with red light therapy? Forrest Smith will tell us how. He is the CEO and co-founder of Kinion, a company dedicated to redefining recovery and performance through accessible science-backed red light therapy. And what's so special about this company is that it is a breakthrough targeted red light therapy device used by thousands of biohackers, athletes, and health professionals to reduce pain and speed up recovery. So Forrest, tell us more about how entrepreneurs and sports people and athletes can reduce chronic pain with red light therapy.
Heal Podcast with Lily Patrascu shares longevity and anti-aging techniques to stay young forever, increase energy, overcome addiction, and live your longest, best life ever. Shared by world's most innovative, alternative, and traditional health thought leaders, healers, and doctors. Discover quantum healing strategies to heal your mind, body, and soul.
It's a great starting point, and thank you so much for having me today. I think we've spent so much time in the weeds of the science on this that it's worth kind of listing out a few of the main ways that we interact with our lasers and the physiology. And so just in case people haven't seen the product, we make these wearable laser therapy devices, sub $500, which is kind of the only laser therapy device in the world that is kind of more affordable and meaningful for treating internal tissue. But essentially, we've made a wearable version of this. So you can strap this on wherever your pain or inflammation, and particularly inflammation-mediated pain. So if you've got osteoarthritis, if you have chronic gut inflammation, anywhere in your body that you really have an inflammation-based pain source, this is something that you can use for 15 minutes a day, just by strapping it on, turning it on. And we recommend that people do this in conjunction with other habits. And so habit stacking is a big coaching point and education point that we work on with our users and also with our medical professionals that we work with, who kind of take that message effectively with their patients as well. And what that looks like is typically a lot of people are trying to do this with what's more aspirational habits, things like meditation. But I think the question to ask yourself is, what have I done consistently, historically, over the last 2 weeks to a month? And so we also often get people saying like, hey, should I pair this with my meditation? How many times have you meditated in the last 2 weeks? If it's one time, this might want to go with your Netflix because you're actually doing that more consistently versus just the kind of more aspirational type habits. So finding a habit that you can stack it with and being very consistent in the treatment and treating for 15 minutes a day makes an incredible difference, particularly for soft tissue issues like knee or shoulder or joint osteoarthritis is a really big piece that we treat. Our older users, we work with everyone from NBA, NFL, special forces, kind of military groups, all the way through to 80, 90-year-old people who just want to be able to get up and down the stairs and retake some level of mobility and movement in their life. And so this really is a very approachable and very easy technology to implement. And that's been our goal, is to reduce the friction points for people to adopt it.
Thank you. Tell us why this red light therapy works and how it works.
So it works by way of providing dosing photons, which contribute electrons into different signaling photoacceptors in the body. And that sounds relatively complex, but what that really is there's 8 or 9 different types of molecules in your body that accept electrons from these different photon delivery sources that we can target. We spend a lot of time developing mathematical models as to how photons distribute through human tissue and how we can optimize that for the best outcomes for people. The basic example of how that would work within human physiology is with hemoglobin. Hemoglobin is a carrier molecule for nitric oxide and oxygen in our body. When hemoglobin is carrying nitric oxide, we can actually reduce the affinity of nitric oxide to stay connected with this hemoglobin, which puts more nitric oxide into your bloodstream, opens up your blood vessels, and actually contributes to more flexible and less stiff arteries and blood vessels for your cardiovascular system over time. The other benefit of that is when you reduce the affinity of nitric oxide for binding to this hemoglobin, that site is a co-binding site for nitric oxide and oxygen. So that hemoglobin can now take on oxygen and better deliver oxygen to other parts of your body. So what you do is you see better blood flow to the area that you're treating, and you see oxygen delivery increase as well. There's a number of other types of cellular impacts for increasing energy production and reducing oxidative stress and reducing inflammation. But those are relatively complex from a biochemistry standpoint to talk through.
Thank you. How does this red light therapy device compare to other red light therapy devices that exist in the market?
So one of the things that we've done differently is one of the key points of what makes light therapy or photobiomodulation work effectively is the dosing. And so we spend tens of thousands of hours with our laser and physiology team modeling how we deliver photons most effectively to the photoacceptors that are going to trigger the best health outcomes for our users. So the dosing model is different. We've actually built lasers into these devices versus just LEDs. And the main difference for those is LEDs emit light in a very broad pattern. And it's very difficult to deliver effectively to the internal tissue without overdosing the superficial tissue. So we've created a balance in how we dose these. It's a class 1 laser therapy device that is FDA cleared and listed, and completely safe to use. No potential damage to the eyes. Even you don't need to wear any kind of special laser blocking glasses or anything like this to protect your eyes. And it's wearable. It is travel friendly. We've actually gone through additional FCC processes to be able to make this. One of the NFL teams that we work with, they're on the road a lot, and they were getting pulled out of security lines. And so they requested that we go through additional FCC processes to make it easy to get this on an airplane and travel with. And we want people to keep their habits up, because their habits and their consistency is what drives the best results for them. And so we've gone through everything we can really to make this as easy, as low friction, and as functional and convenient as possible to use and to build habits around.
Thank you. Tell us what kind of conditions red light therapy, this particular device, can help with.
I would say that there's a lot of these, and really the main thing that we're doing is we're treating upstream mechanisms that increase the mitochondrial function. So increase energy generation, reduce oxidative stress, and reduce inflammation. And so what you can use that for treating is improving your cardiovascular performance and health as a human. You can use this for treating chronic inflammation and pain points like osteoarthritis. If you have osteoarthritis of the shoulder, knee, elbow, etc., this actually helps massively with that, and can reduce the inflammation so that you can actually grow back your cartilage at a much more effective rate. We also see a lot of our professional athletes using this for repetitive stress injuries. So things like golfer's elbow, tennis elbow, patellar tendonitis, plantar fasciitis, Achilles tendonitis. All of these are repetitive stress injuries that are very powerfully affected by particularly the infrared light that we're using in the laser portion of the devices. We also, I personally use it for treating my gut. The impact on the gut biome is really powerful. You see a good shift in what's called the FB ratio, which is two different types of I guess, kingdoms of different organisms in your gut. You see an increase in short chain fatty acids like butyrate in your gut. And you can also use it to increase neurotransmitters. So a lot of the dopamine and serotonin that you have in your body is generated in your gut. And treating your gut over 2 to 3 weeks, this actually does take some time, it's not immediate, makes a big impact in your daily mood and the kind of what they refer to in the medical literature as affect. So how you feel and how your energy levels are on a daily basis.
Wow, fascinating. Tell us, what is the time scale for someone to start feeling the impact of the red light therapy device?
It's an excellent question, and it really depends on what you're treating. So we try to set expectations very deliberately from the longest area of the body. One of the things that takes the longest to treat, because there's less tissue there for us to interact with, is things like your hands. So we treat a number of people who have, our older users have osteoarthritis in their hands and their knuckles. That takes up to 2 months, so 6 weeks to 8 weeks to be able to see that outcome. On the other side of the fence, if you're treating something that has an inflammation, a short-term inflammation piece to it, so we work with a lot of high ankle springs with our NBA partners. Ankles swell up a ton. You can reduce that swelling and engage growth factors in the area that allow you to heal, reduce pain, and get back into. With a high ankle sprain, what we've seen is a shift is something from say a month, which is typical for a high ankle sprain recovery, down to less than a week. So really strong impacts for things like that from a recovery from injury standpoint.
Thank you. What else would you like entrepreneurs and athletes to know about red light therapy and how they can reduce chronic pain?
There's not really anything else out there that can provide these type of results. And I think there's a couple of things that we do a lot of education around with pharmaceuticals. One of our core goals as a company is to give people an alternative to pain relief from opioids and NSAIDs, or non-steroidal anti-inflammatory drugs. With the non-steroidal anti-inflammatory drugs, what you would anticipate from a anti-inflammatory drug is that it's reducing inflammation and that you're seeing something similar to the outcomes from light therapy or photobiomodulation. In fact, this is not the case. The NSAIDs, when you're taking them chronically, increase stiffening of your blood vessels and arteries, increase mortality rates by 50% by way of heart failure and heart attack across the board. Whether you're 6 or 60, your specific incidence of heart disease will increase by 50% if you're taking NSAIDs. So we try to do a bit of education on suggesting for people to get away from these over-the-counter pain medications and work with something that's going to, instead of just taking the batteries out of the smoke detector, is actually going to put the fire out. And that's what we do with red light therapy and photobiomodulation.
Thank you. I've suffered from migraines and sore throat for 10 years. And to some extent, you can say I haven't fully recovered. Like I still am suffering from sore throat. And I've kind of recovered from migraines and I just have some random headaches. Is there a possibility to recover or to kind of reduce the pain with red light therapy? And if yes, where do you position the device?
So yes, and I will say though that migraines and headaches are multifactorial, and so we want to be as upfront as possible on. We treat there's about 8 different causes of migraines and headaches. We treat 5.5 of these. One of these we actually treat somewhat effectively, but less effectively than others. And there's a very good hit rate for this with our users because those 5 to 6 are the most common ones. When you're doing this, you can actually extend out the straps and put it around your neck. And then if you have, there's a number of different ways that, again, that headaches and migraines are triggered. But what we've done is we've tried to address as many as we can with the laser therapy. And we've also developed because our users were having this problem, we wanted to help them with it. We've gone through 15 or 16 different iterations of a trigger point release product. When you add these two together, you get to 7 out of 8 of these migraine and headache trigger points. Much of it kind of goes back to that fascial release. So when you can do both of those together, there's a really high percentage chance that you're going to be able to fix your headaches and migraine triggers. And there's a really powerful outcome for this, both that we've seen with ourselves, our users, but also with the medical research around this.
Thank you. For those people that, let's say, don't experience any sort of pain, but they're feeling relatively lethargic and they want to have the kind of energy that you have, like you seem to be very pumped right now. Is there anything they can do to use red light therapy to kind of get more energy and feel less lethargic?
I'll share with you my protocol for this, which has been amazing. We developed this with a Japanese lab who was doing research in the space. We work very effectively with hemoglobin, and 2 of the largest blood vessels that are very close to the skin in your body are in your neck. So every day, and I saw a very big lift. It took about 10 days to 2 weeks to really see this energy. In the research, they call this affect, which is typically kind of your energy and focus and mood. And so there's very, very big shifts that you see both from the research standpoint and from the kind of anecdotal user-based standpoint that we interact with so much. So you put these 2 vertical modules over these very large blood vessels in your neck. And then you do 15 minutes of treatment on your neck. And then you do 15 minutes of treatment on your lower abdomen. So about 1 inch to 1.5 inches below your navel. And the combination of these, there's what they call an abscopal effect or remote effect, where you treat one area of the body, but because this blood is distributing throughout your body, there's two major impacts for this. One is increasing affect and neurotransmitter. A lot of the neurotransmitters in your body are generated in your gut. So when you treat your gut with laser therapy, you're able to see an increase in these dopamine and serotonin levels throughout your body. And when you're treating your blood, you see an impact almost systemically from a reduced inflammation standpoint. So when you reduce that inflammation, when you reduce the oxidative stress, the big impacts for that long term are that affect, that mood, the neurotransmitter impact, and immune health. And so again, that's what we see both from the medical literature, but also from our own personal experience and our user. We do very kind of deep and detailed follow-ups with a lot of our users, because our company is mission driven. Our mission is to increase the quality of life for the largest number of people we can in the most measurable way we can. And so we work with our users to really understand how we can help improve the protocols ongoing and provide better outcomes from a health standpoint. And again, the immune responses and the affect or mood responses from this type of treatment are just amazing.
Thank you. Tell us some case studies that you've worked with where people have optimized their health, and give us some examples of what they've optimized.
Absolutely. I think, some of the most exciting ones, again, for me, so there's two ends of the spectrum. One is kind of our professional athletes and world-class special forces guys and all this, who can lift an entire house from a weightlifting standpoint and are just in such great shape. A lot of these guys have very heavy workloads and intense workloads that give them things. And, the U.S. Olympic weightlifting team is a great example. They do a lot of the same movements over and over and over as part of their training regime. Whether it's an Olympic weightlifter or a golfer or a Major League Baseball pitcher, what you see is repetitive stress injuries. And so that's one of the ones where being able to help these guys get back into training much faster and stay healthier longer and have healthier tissue, even though they're repetitively stressing that tissue, is a really interesting, and it's just great because I get to see people who I've always looked up to from an athletic standpoint. But for me, what moves the needle the most is our older users, where we see being able to adopt this for particularly joint pain. One of the things that's a trigger for mortality for older users is having joint pain, and we kind of refer to it as boiling the frog. Their knee hurts, so they shorten their walk. And then their knee hurts more because they're not moving it enough. And then so they shorten their walk more, or they shorten the amount of movement they have in a day. When they're able to use red light therapy, they can reduce the inflammation and reduce the pain and get back into movement. And in so many cases, this has added not just years to their lives, but functional years where they sleep better, they're able to move more, they actually have a health span versus just a lifespan. It's not putting bad years at the end of your life. It's able to extend the health span where you can actually enjoy those years and be out in movement. And for me, that's the biggest and most motivating impact that we make as a company.
Thank you. Tell us where entrepreneurs can find you.
You can find us at Kineon, Kineon.io, and we do a lot of blogs there, kind of trying to educate a little bit about how the devices work and how the technology works fundamentally, and also on Instagram at Kineon_labs. We also have a very strong and vibrant Facebook group that you can find us with if you just search Kinion in Facebook, and that's a lot of users sharing their users and medical professionals sharing their own different protocols and what's worked most effectively for them. And it's a great place for people to find out more about the devices and what you can expect from the experience.
Thank you. Tell us, how long should someone aim to use this device every day?
15 minutes per area of treatment. And personally, I do, again, this proximal priority therapy, which I have on my neck now, my lower gut, and then I have old injuries in my lower back, and knee from grappling, and so those flare up occasionally because I'm middle-aged, but I haven't given up my CrossFit and I haven't given up my rugby, and both of those are reasonable ways to kind of trigger flare-ups in muscular or kind of joint tissue. And when I do have those flare-ups now for my knee or my lower back, I use this as well, and it gets me back into movement, back into training so much faster.
Thank you. For those people that are feeling great right now, is this a great tool for rejuvenation and optimizing your health for the future?
Absolutely, and particularly with that proximal priority theory again that I'm doing right now. The other thing that we've seen very effective is, and I don't use it this way myself, but my wife does at the skin level. Being able to treat your skin, you increase the proliferation of type 2 collagen and also fibroblasts, which essentially just kind of rolls back the clock on how your skin looks. Less wrinkles, younger looking skin, faster generating skin, and it's very healthy from a longevity standpoint. We have a number of people who've been using it in this way as well.
Wow. So when you use it for the skin, where do you put the device?
I'll show you. Typically, and again, I don't normally use it with my skin, which is probably why I have more wrinkles than I should. But you can use it in the orbital areas of your eyes. You can also use it on your neck with if you have any kind of wrinkles or stretch marks on your neck. People also use it for skin on their abdomen. So one of the things that we've seen very effective for this is post-pregnancy, particularly when there's a C-section. This actually helps grow a lot tighter, smaller scars and scar tissue that is much more in line with or similar to the original tissue. And so C-sections become much smaller, but also some of the stretch marks from pregnancy reduce dramatically. And so these are areas of the skin that we see quite a lot with different users.
Thank you.
Follow me for more interviews with world's most innovative health change makers to live your healthiest life ever.